morning everyone. Today I am going to talk about total muscle transplantation procedure for a large angle deviation. No financial disclosure. So the purpose of this paper is to demonstrate the effectiveness of total muscle transplantation procedure as a primary surgical procedure in case of large angle deviation. It's a case-based study with 3 patients having large deviation more than 70 PD, and the muscle transplantation procedure was done as a primary procedure for these people. Study area is RIO Bangalore. Patients large angle horizontal deviations, and patients who had given informed consent for the procedure was included in the study. And paralytic squint, FP2025 test positive squint, and previous history of squint surgeries were accepted. So this is the pre-evaluation. As you can see, the case 1 had left eye suppression with a large deviation of 70 PD, exotropia. Case 2 had left eye suppression with 70 PD, esotropia. Case 3 had right eye suppression with 70 PD, exotropia. So this is the surgical procedure. If you consider a case of exotropia, usually you do medial rectus resection and then you do LR recession. But in this case, the resected part of the medial rectus, as you can see, which is shown in yellow color, is attached to the lateral rectus to cause a lengthening of the lateral rectus, and this causes further weakening of the lateral rectus. So here we are marking the amount of muscle to be resected. We are using a 6-0 vicryl suture to stabilize the muscle, and then you are cutting the medial rectus. So the stump which we get, the MR muscle, is kept aside in saline. Then we go to the LR side. So we are using a 6-0 vicryl suture again, and you're cutting it at the insertion site. So the stump of the muscle which we have kept aside, the MR muscle, we are going to do an end-to-end anastomosis here. And finally, we are going to use 6-0 vicryl to suture it to the new insertion site. So this is the same thing on a clay model. So this is the case 1. As you can see, she had a large exotropia. Post-operatively, it's ortho. So this was case 2 with large ESO. So results, case 1 and case 2 was orthotropic, whereas case 3 had residual 10 PD of exotropia. So usually for large angle deviation, we can either do a 2-eye surgery, or you can do a supra-large recession and resection, or you can use a botulinum toxin. But in this case, why our technique is better than the other techniques is it does not restrict the ocular motility, and it avoids resurgery. You can only operate on the non-dominant eye, so you're avoiding surgery on the dominant eye. And you can leave the other eye unoperated for any further additional surgeries. And there is no restriction of movement. So we can consider this muscle transplantation surgery as a good alternative primary surgery on a non-dominant squinting eye in case of large angle deviations. Thank you.